Tubal obstruction and infertility. Tubal obstruction is the most common cause of infertility. Why is that? Because most tubal obstructions are caused by induced abortions. Induced abortions result in tubal blockages, ultimately leading to infertility. This is a common and prevalent phenomenon. There are two main approaches in treatment. One is to naturally conceive by unblocking the fallopian tubes. The other is to undergo in vitro fertilization, IVF. I will focus on tubal obstruction. Tubal obstruction can be unilateral or bilateral. It can also occur at different locations, such as the isthmic part, ampullary part, fimbrial end, or infundibular part. It is crucial to determine whether it is unilateral or bilateral and the specific location. This information is of vital importance for diagnosis and treatment. If these diagnoses cannot be clearly determined, blindly pursuing IVF can be a waste of time, money, and ultimately lead to disappointment. The diagnosis mainly relies on fallopian tube iodine oil imaging. Only imaging can determine the location and unilateral or bilateral blockage. Other tests, such as fluid passage, cannot provide a diagnosis. Fluid passage cannot determine whether one side or both sides are blocked. Hysteroscopy can differentiate between one-sided and two-sided patency, but it cannot determine the specific location of the patency. The side that is blocked and the specific location of the obstruction cannot be diagnosed. Therefore, iodine oil imaging is the gold standard. Dynamic digital hysterosalpingography is the gold standard for diagnosing tubal infertility. In terms of treatment, we advocate unblocking the fallopian tubes as much as possible to achieve natural conception. If unblocking is not successful, such as when both fallopian tubes cannot be unblocked, or in cases of repeated ectopic pregnancy or absence of fallopian tubes, then assisted reproductive technologies such as IVF are recommended. We do not recommend rashly pursuing IVF treatment, as it is expensive and has a low success rate, leading patients down the wrong path. Many people take the wrong path with IVF. But Dr. Yang Shuhua, the president of Antai Yang Shuhua Hospital, invented the Yang's fallopian tube recanalization method, which involves two mirrors, Cook guide wires, and a tubal stent, and can guarantee that over 90% of patients achieve natural conception. The treatment is conducted under a contract, and if the desired outcome is not achieved, a full refund is provided.